Good afternoon, everyone, and thank you for joining us for this webinar. My name is Ami Gadia, and I am the Chief of Policy, Research, and Programs at Child Care Aware of America. I will be your moderator for this afternoon's webinar. First, I would like to welcome Dr. Lynette Fraga to get us started. Lynette is Executive Director of Child Care Aware of America. Lynette began her career in early childhood as a teacher in infant, toddler, and preschool classrooms, and has since held positions at the local, state, and national level within the nonprofit, corporate, and higher education sectors. She earned her doctoral degree in family studies from Kansas State University, a master's degree in human relations from the University of Oklahoma, and a bachelor's degree in special education from the University of Arizona. Now I'll turn it over to Lynette.
Good afternoon, everyone, and thank you, Ami. First, I am grateful for the many early childhood educators, home-based and center-based providers, child care resource and referral agency staff, child care system planners and leaders, public health staff, medical health staff, child care health, and early childhood mental health consultants, philanthropists, advocates, researchers, and other professionals committed to ensuring the health, safety, and wellness of our nation's children, particularly given this challenging time we find ourselves in. Thank you for the work you do each and every day. Recently, the Centers for Disease Control and Prevention released an update to the Supplemental Guidance for child care programs that remain open. This updated resource provides guidance specific to child care on issues such as general preparedness and planning, preventing the spread of COVID-19, monitoring and planning for absenteeism among your staff, reviewing plans for implementing social distancing strategies, and assessing group gatherings and events. Additionally, this guidance provides detail for providers and programs that choose to remain open, focusing on social distancing strategies, cleaning and disinfection efforts, modifying drop-off and pickup procedures, including screening, caring for infants and toddlers, healthy hand hygiene behavior, food preparation, meal service, vulnerable and high-risk groups, and how best to maintain adequate staff-to-children ratios to ensure safety. The guidance also provides numerous links to resources that provide even greater detail, including information regarding children's risks from the coronavirus. The document, with additional considerations, is intended to provide guidance for a range of child care programs, including family child care programs, also known as home-based child care, pre-K programs at private and public schools, Head Start and Early Head Start programs, private child care centers, temporary child care centers operated by municipalities for the children of essential providers, such as first responders, healthcare workers, transit workers, or other industries where a parent cannot stay home. Child care centers that partner with healthcare facilities to support healthcare workers who need child care, and more. And now, I would like to turn it over to our moderator, Ami Gadia. Ami?
Thanks, Lynette. All right, we are joined today by a CDC expert who helped author this guidance that Lynette just spoke about, Alexandra Levitt. Dr. Levitt is a health scientist in the CDC Health Science Communication Office at the National Center for Emerging and Zoonotic Infectious Diseases. Since joining CDC in 1995, she has coordinated policy reviews and initiatives in such areas as global health, outbreak assistance, and bioterrorism preparedness, and contributed to interagency strategies and implementation plans that address antimicrobial resistance, pandemic influenza, healthcare-associated infections, and biological threats. Dr. Levitt began her government career as an American Association for the Advancement of Science Diplomacy Fellow assigned to the U.S. Department of State, where she coordinated a government-wide review of the global health and security threat posed by emerging infectious diseases. The findings of that review became the basis of the first presidential decision directive on global infectious disease policy. Dr. Levitt holds a PhD in biology from Columbia University and formerly served on the faculty of the New York University Department of Medical and Molecular Parasitology. We appreciate Dr. Levitt's time today to review the new guidance with us and provide answers to some frequently asked questions about it. After Dr. Levitt's presentation, Heidi Hotvet, State Coordinator for the Iowa Department of Public Health's Healthy Child Care Iowa program, and Melissa Jewell, Regional Director of the Iowa Child Care Resource and Referral Agency, will highlight some real-world implementation of this guidance. Heidi Hotvet is the State Coordinator for the Iowa Department of Public Health's Healthy Child Care Iowa program. Heidi graduated from California State University, Fresno, with a Bachelor of Science in Nursing and Certificate of Public Health. She has worked with children and families in community health throughout her career. In 2007, she began working with Healthy Child Care Iowa as a local child care nurse consultant for 2 rural counties in eastern Iowa. She was hired as the program coordinator in 2015 and has a passion for the child care health consultant role. Melissa Jewell works for Mid-Sioux Opportunity Incorporated, a community action agency, and is a certified community action professional. She is the Child Care Resource and Referral Regional Director for Northwest Iowa, covering 23 counties. As Director of Northwest Iowa's CCR&R, she oversees the statewide communications specialist work, statewide community development specialist, statewide emergency preparedness team, and implementation of the Child Care Aware of Americas and the Enhancing Preparedness and Response capabilities for early learning providers, families, and children grant. We hear each day about the experiences from the field about the struggles, challenges, and questions from providers and our CCR&R partners. And we want to tell those stories and highlight both the work heroically done by all of you that care for children, as well as raise up the very real concerns this pandemic surfaces for both parents and the early childhood educators supporting essential personnel across the country. So then after that, we'll have time for Q&As. With that, I would now like to turn it over to Dr. Levitt.
Okay, well, thank you very much. I much appreciate the opportunity to speak about CDC's guidance on child care programs that stay open during these very challenging times. And I wanted to thank the previous speaker, Lynette Fraga, who I thought gave an excellent overview of what I'm going to talk about she gave the headings and the general gist of what's in the child care guidance, and I'm just going to fill that in with a little more detail. So the next slide, please. Okay. As you can see in this slide, the CDC guidance can apply to many different types of child care programs. These include family child care programs, also known as home-based child care, pre-kindergarten programs at private and public schools, Head Start and Early Head Start programs, private child care centers, temporary child care centers for the children of essential service providers, such as first responders, healthcare workers, transit workers, and/or other industries where a parent cannot stay home. And finally, child care centers that partner with healthcare facilities to support healthcare workers who need child care. And these different kinds of child care centers, I hope will get different things from the guidance, but the principles are the same for all. So CDC has updated this guidance mostly around ways to screen children on arrival for signs of illness, and I'll describe that in more detail in a few minutes. Actually, this updated guidance was posted last night. Okay, next slide, please. Thank you. The CDC guidance begins by discussing general preparedness and planning. It emphasizes that, regardless of the level of transmission in a community, child care programs should have a plan in place to protect staff, children, and their families from the spread of COVID-19. Plans should address these issues: preventing the spread of COVID-19 by encouraging staff to take everyday preventive actions such as washing hands, covering coughs and sneezes, cleaning and disinfecting frequently touched surfaces, covering mouth and nose with cloth face coverings. That's a fairly new update when you have to go out in public, and planning to ensure adequate supplies to support these steps. Also, requiring sick children and staff to stay home. Establish procedures to ensure that children and staff who come to the child care center sick or become sick while at your facility are sent home as soon as possible. Plan to have an isolation room or area, such as a cot in a corner of the classroom, that can be used to isolate a sick child. It is important to keep sick children separate from well children and staff until they can be sent home. It's also important to monitor and plan for absenteeism among staff such as by securing extra substitutes, and to review plans for implementing social distancing strategies, avoiding mass gatherings, and limiting non-essential visitors. The next slide, please. Okay, this slide lists the topic headings in the CDC guidance, and I'll briefly review the information under each heading. Social distancing strategies. Child care programs that remain open during the COVID-19 pandemic should implement social distancing strategies such as having each classroom include the same group of children each day with the same child care provider, canceling or postponing special events such as festivals and holiday celebrations, halting or altering group activities, for example, staggering playground times, spacing out children's nap time naps or cribs as much as possible, and also, if possible, having administrative staff telework. Okay, cleaning and disinfection. Child care programs should intensify cleaning and disinfection efforts. Routinely clean, sanitize, and disinfect surfaces and objects that are frequently touched, especially toys and games, and objects and surfaces that are not ordinarily cleaned daily, such as doorknobs and light switches. The cleaning and disinfection section of the guidance also provides a link to instructions for selecting appropriate sanitizers and disinfectants, and detailed information on cleaning and sanitizing toys and cleaning and disinfecting bedding. Toys that cannot be cleaned and sanitized should not be used. Okay, the next heading is parent drop-off and pickup. Child care programs should modify procedures for drop-off and pickup, provide hand hygiene stations and sign-in sheets at the entrance of the facility so children can clean their hands before they enter, place sign-in sheets outside, and provide sanitary wipes to clean pens between each use. Stagger arrival and drop-off times and/or plan to limit direct contact with parents as much as possible. Have the same parent or designated person drop off and pick up the child every day. Now, if possible, children should be screened on arrival. Children who have a fever of 100.4 Fahrenheit or above, or other signs of illness, should not be admitted to the facility. Encourage parents to be on the alert for signs of illness in their children and to keep them home when they are sick. The updated guidance describes 3 ways to safely screen children upon arrival, and I'll come back to them at the end of my talk. Okay, caring for infants and toddlers. The CDC guidance also addresses issues related to caring for infants and toddlers, including procedures for diapering young children. The CDC guidance recognizes that social distancing is challenging when caring for very young infants, and toddlers. To the extent possible, then, when washing, feeding, or holding very young children, it is suggested that child care providers wear an overlarge button-down long-sleeve shirt and clip-back long hair, wash any body part touched by a child's secretions, and change their own clothes and the child's clothes if secretions are on them, and wash hands. Place contaminated clothes in a plastic bag or washing machine. It is also recommended that child care providers wash their hands before and after handling infant bottles, whether they're prepared at home or prepared in the facility. Bottles, bottle caps, nipples, and other equipment used for bottle feeding should be thoroughly cleaned after each use by washing in a dishwasher or by washing with a bottle brush, soap, and water. Okay, healthy hygiene. All children and staff should engage in healthy hand hygiene behavior. Wash hands with soap and water for at least 20 seconds or with hand sanitizer if soap is not available. Assist children with hand washing, including infants who cannot wash hands alone. Supervise children when they use hand sanitizer to prevent ingestion. Place posters describing hand washing steps near sinks. Food preparation and meal service. Extra precautions should be taken around food preparation and meal service. The recommendations are: serve meals in classrooms. Food preparation should not be done by the same staff who diaper children. Sinks used for food preparation should not be used for any other purpose. Caregivers should ensure that children wash hands prior to and immediately after eating. Caregivers should wash their hands before preparing food and after helping children to eat. Okay, the guidance also addresses issues that are related to protecting people at higher risk for severe illness from COVID-19, and I think this is an important point. Based on currently available information and clinical expertise, older adults and people of any age who have serious underlying medical conditions may be at higher risk for severe illness from COVID-19. To protect those at higher risk, it's important that everyone practices healthy hygiene behaviors. If you have a staff member or teacher age 65 or older or with serious underlying health conditions, encourage them to talk to their healthcare provider to assess their risks and to determine if they should stay home. Information about COVID-19 in children is somewhat limited, but the information that is available suggests that many children have mild symptoms. However, a small percentage of children have been reported to have more severe illness. So if you have children with underlying health conditions, talk to their parents about their risk. Also, continue to follow children's care plans for underlying health conditions such as an asthma action plan. Finally, if you have children with disabilities in your care, talk to their parents about how their children can continue to receive the support they need. Okay, the last slide please. Okay. This slide lists other guidance resources that you might find helpful. The CDC website contains a variety of resources for child care programs in K-12 schools, including frequently asked questions for administrators, teachers, and parents. Together, these resources provide additional information on what to do if a child or staff member at your facility becomes sick, and also about closures of child care programs. The resources emphasize that any decision about temporary closures of child care programs should be made in coordination with your federal, state, and local educational officials, and also with state and local health officials. Child care programs are not expected to make decisions about closures on their own. Okay, I'd like, now that I've covered the content, I wanted to come back to the issue of how to screen children on arrival to ensure that children who are sick are not admitted to the facility. The updated guidance provides 3 detailed examples of how a child care program can safely screen children upon arrival for fever and other signs of illness. The first example involves reliance on social distancing. The second relies on barrier or partition controls. And the third, which was included in the original guidance, relies on using personal protective equipment or PPE. That last option may still be used if supplies of PPE are readily available and if your staff is trained in using PPE and is comfortable with using PPE. But if not, the other 2 examples are recommended. In regard to the example involving reliance on social distancing, the updated guidance says, ask parents or guardians to take their child's temperature either before coming to the facility or upon arrival at the facility. Upon their arrival, stand at least 6 feet away from the parent and child, and ask the parent to confirm that the child does not have fever, shortness of breath, or cough. Make a visual inspection of the child for signs of illness, which could include flushed cheeks, rapid breathing, or difficulty breathing, fatigue, or extreme puffiness. You do not need to wear personal protective equipment if you're able to maintain a distance of 6 feet. In regard to the example involving reliance on barrier or partition controls, the guidance says, during screening, stand behind a physical barrier, such as a glass or plastic window or partition, that can protect your face from respiratory droplets that might be produced if the child being screened sneezes, coughs, or talks. Make a visual inspection of the child for signs of illness and then conduct temperature screening using this protocol. Wash your hands and put on disposable gloves. Check the child's temperature, reaching around the partition or through the window, and make sure your face stays behind the barrier at all times during the screening. So I should have said that this was added because of feedback that we received from our partners. So in conclusion, we've been very grateful for the impact and feedback we've received from Child Care Aware and all of our other child care partners. We hope that the updated guidance is helpful. If there's time at the end, we will be answering questions that you have submitted at the end of this webinar. Thank you so much.
Thank you so much, Dr. Levitt. Now I'd like to introduce our partners from Iowa, Heidi Hotfett and Melissa Jewell, to share their real-world examples and stories of how childcare has been impacted by COVID-19.
Hi, thank you very much. This is Melissa Jewell. I am the Regional Director for Northwest Child Care Resource and Referral. Before we start, Heidi and I talked about how we can maybe give an overview of how Iowa is working together at a statewide level and at a local level to make sure that we're trying to be as helpful as possible to all child care providers and we're getting the correct information out to them. So from a starting point, the Iowa Child Care Resource and Referral starts with the funding coming from the Department of Human Services. They divide the state into 5 regions. I'm Region 1, which is the blue counties shown on this slide. Iowa's leadership really tries to have a cohesive leadership model. So even though there are 5 different agencies, we have a network that comprises of each one of the 5 regional directors and a Department of Human Services contract representative, I should say. And so the 5 of us really work to make sure that child care providers, regardless of what region you're into, get similar services, so there's uniformity. We also have a lot of statewide teams so that if a provider in the Northwest County of Iowa can also get the same services that they get in the rest of the state. Can you move to the next slide, please? To make sure all of this happens, we all have the same consistent type of positions across the state. Each region has a regional director. They have local child care consultants and supervisors, business and community specialists who really work with making sure that our child care centers can be operational, and then also that we make links to businesses so that we can have the strongest child care available in the area. We also all have quality rating system specialists, training specialists, and data specialists. So these people are really who are working one-on-one with our programs locally. They're trying to find out what needs they have, and they communicate to their statewide partners also what's going on so that we have the most adequate information possible. The department also invests in 3 different statewide positions. The first one is a statewide parent referral specialist. So to be efficient with our time, one of the regions, Region 5, does all of our parent referral specialists. But all the other regions are still responsible to have that communication. We've been having, talking to the child care providers as much as possible. Our governor even said that they are required to communicate to us their vacancies. So as soon as we know a vacancy locally, we're trying to get it into the database so that the essential workers have access to the child care that they need during out this time. There's also 2 other statewide positions, the statewide curriculum specialist and the statewide communication specialist. Both of these positions, again, represent the whole state, but they operate out of our region, Region 1. Later on, we're going to talk more in depth as to what the statewide communication specialist is doing, but I just wanted you to see all of these positions as a system, and this is really what it's taking for us so that we can respond timely, not only as a local level, but also as a statewide level. Next slide, please. For us to operate at the statewide level, we do need to work with all of our partners. So a lot of the information that we're getting and we're sharing comes from the Department of Human Services. We work with their staff in the central office. That's where we get a lot of our guidance and direction from. But it's also important that our local child care consultants are working with the local compliance staff. So we really are in partnership with them as to who has what needs. If temporary child care is needing to happen in a place, the local compliance staff are the ones going into there. So we're just really trying to work together to make sure that we meet the community needs. The other big partner that we're in with this is the Iowa Department of Public Health, and Heidi is going to talk a little bit about that. but we do work with Healthy Child Care Iowa, our local child care nurse consultants, and the county public health departments. And again, Heidi will go into that in a little bit later. Also, throughout this whole pandemic, it's also important that we are connected to our emergency managers. Iowa has 99 counties, so we need to make sure that we are in contact with them, that they understand that we are here as a resource, and that we can connect the essential employees and staff to childcare if that is needed. Also, as an outcome from this pandemic, we are also having to reach out to small business development specialists. Tom Copeland has done some statewide webinars trying to give some information to child care providers on the resources out there. Also, we're putting them in connection with other financial institutes, their local banks, things like that. We're also having to direct them to a lot of information to Iowa Works so they have information about unemployment. So really, whether it's at the statewide level or at the local level, we're really trying to, again, get that information out to providers, but it really takes a big team to get all the information together. Heidi, I'll let you go on and talk a little bit about this formation of the Iowa Department of Public Health and Healthy Child Care Iowa.
Thank you, Melissa. This is Heidi Hotbed, and I want to just do an overview of Iowa Department of Public Health's Healthy Child Care Iowa program. So the Healthy Child Care Iowa program is part of the Maternal Health and Child and Adolescent Health Program. And we receive assistance and funding from our state partners, Iowa Department of DHS and Iowa Department of Management, Early Childhood Iowa. Healthy Child Care Iowa receives supports to improve the quality of health and safety in early care and education programs. And we work with programs that work with infants, toddlers, preschools, and school-aged children and their families. And what Healthy Child Care Iowa program does is we provide structure, coordination, training, and fidelity for our child care nurse consultants. Our child care nurse consultants are under the umbrella of child care health consultants nationally. Next slide, please. So in Iowa, child care health consultants are licensed registered nurses and are identified as child care nurse consultants. Child care nurse consultants are health professionals with early childhood experience. They have knowledge of child care practices, rules, and regulations. They integrate health into early learning systems and help programs understand infant and childhood development and a range of health topics, including children with special health needs. And child care nurses also assess the health and safety needs of child care programs and are part of the Iowa Quality Rating System. Next slide. In Iowa, we have 99 counties, and we have 34 local nurse consultants that cover all counties. And this is our state map showing our areas. Most of our nurse consultants work at least a half-time position or a full-time position, depending on their service area and the number of child care providers they provide services to. Next slide. Next, thank you. Healthy Child Care Iowa works to support our local nurse consultants, and we also have a statewide website. The Healthy Child Care Iowa website is here on your screen. And on that screen, on that website, we have fact sheets, posters, resources, and we actually have a COVID-19 resource section on the printed products page of our website. And all of those resources and posters are available for free for the public. So if there's something that you've found on our website that would be a resource that would work for your area of your state, you can always download and print products from that site. Next, I think we're going to talk a little bit about, you can go to the next slide, is our communication. So I don't know, Melissa, would you like to start us off?
Sure. The key that we found that we've been dealing with here in Iowa is that there is so much information coming down and around the COVID-19 virus. There's so many things for child care providers to know that maybe they've not been aware or had to use that information in the past. So how do we get that in a place where they can find it and be consistent? So one of the first things we did is we changed our website. So for Iowa, ccrnr.org is our website. And so on the front main page, what we added is all of the big communication pieces. What is our Governor Reynolds proclamations that are associated with child care? The Department of Human Services have been sending out notifications. We have posted all of those on our page. Anything that the Department of Public Health, Healthy Child Care Iowa has for notification goes on there. And then we've also at one point, Child Care Resource and Referral needed to send out a communication to all child care providers. So anything that we're sending to the child care providers, we want to make sure that they're there and they're easily accessible. What we also found is that all these other resources were coming out and other things that they needed to know. So also on this front page, you can't see it in the picture here, but there is a resources for COVID-19. If providers click on that button, then we have a lot of other helpful information on that resource teams. There's a section for financial information. There's a section for educational assistance as they're doing additional educational things in their childcare right now, and other mental health issues and what can you do in that process. So anything that we are trying to gather up and we're trying to have as a resource, we're trying to put it in one spot so that they can have it there. We are also for CCRNR holding twice a week statewide webinars with all of our staff so we can have communications about what are the new guidances coming out, what does this mean for childcare, what are the resources, and the Department of Human Services is also part of those webinars, and they're there to answer our questions in real time and get that out there so that at the local level we can be answering our questions for the providers that are coming in. Heidi, you want to add anything else to that?
Yes, thanks, Melissa. So this has been a great partnership, and we work with CCRNR between Healthy Childcare Iowa and CCRNR. We've been partners for, we've actually been partners for 20 years. We're coming on our 20-year anniversary for Healthy Childcare Iowa. And working with the CCRNR regional directors, and especially with Region 1 with Melissa, has been really a real opportunity for us to streamline and help provide information and to make sure we have a message that's going out for all providers in our state, and so that providers have that connection, not only sending information out in a statewide system, but sending information out to our local nurse consultants and our CCRNR regions, so that that information can get down to the child care provider locally, so they have that information. At Iowa Department of Public Health, there has been a team. We started our work providing information about COVID-19 with a webinar that was done by Dr. Padati from Iowa Department of Public Health and our state epidemiologist, and had some specific child care guidance in the first webinar that came out early in March. And that was something that we worked with CCRNR to get that communication out so that could go as a constant contact out to all of our providers so they had access to that webinar, either to view it in live, or they could view the recording of it. So that was just a great start off with the communication, getting our communication out on COVID-19 resources, and really supporting, looking at the Centers for Disease Control guidance that was coming out for programs so that we could provide some information for our child care providers to remain safe and healthy. Maybe the next slide.
We are lucky in Iowa that we do have a statewide communication specialist that is funded through the Department of Human Services. And she is able to do a lot of things for us across the state of Iowa to kind of make sure that we have the same resources and communication and answers to child care providers going out. Heidi just mentioned a little while ago that we do have the ability to do constant contact emails. So whenever anything new is being released from the Department of Human Services, Public Health, the governor, that information goes to targeted emails for constant contact. So everybody's aware of that through email. Then anything that's put through constant contact also makes it to, again, our webpage, which is iowaccrr.org. And that's put on the main page, or depending on what a resource might be, it might be put on the COVID-19 resource page. Also, from a local level, anything that our local child care consultants, local nurse consultants, local DHS staff, if they're finding resources, they're also sending us information on that webpage. So our providers can actually even check regionally if there's resources available just in the region that might not be available statewide. And anything, again, also put on that main page of the website or out in constant contact goes into our news feed. So hopefully there's a variety of places where providers can access answers to their questions that they have. And then also our statewide communication specialist does a really good job putting things on social media, on Facebook, Instagram, and YouTube. Again, we have statewide communications, but then each of the 5 regions also have business and community people who also post regional resources and answers and opportunities on there. So we really try to take a multi-pronged approach to get information out to child care providers.
And one thing I'd like to add, like I said, working with the communication specialist, Bobby has been excellent in terms of when things have changed to be able to put out a new guidance, put out a guidance document that has been created by Iowa Department of Public Health or Department of Human Services, and then making sure that providers are aware of that change so that that goes out. I also wanted to just mention that I know Iowa is unique in terms of how our state structure is, with having the piece of child care nurse consultants that work locally with providers statewide, and then having our statewide structure with child care resource and referral and their consultants. And so that partnership has worked very well. But I know other states also have child care resource and referral, and also have child care health consultants available in their states. So that's something that I would just want to share, that that's a great partnership to be able to work together to make sure that the support is there for providers, because that's the important part, is that they feel supported and have the information that they need. Anything else, Melissa?
Nope, I think that's it, unless anybody else has any questions for us.
Thank you both so much, Heidi and Melissa. We really appreciate hearing about everything Iowa is doing in this ever-evolving situation. I know that we have many attendees on who are not from Iowa, but we thought that this information would be helpful to folks to understand how your state is approaching it. We at CCAOA are hearing stories from across the country on how providers are serving their families and their communities in unique ways, perhaps different than what you all were doing just a few months ago. We are using those stories to not only inform our partners and share that out with our peers, but also to share with policymakers to advocate for more assistance and support for the child care field. And that work continues, pushing federal policymakers to give the child care sector the support that it needs. Now, with the time remaining, we'd like to hear from our audience with questions. I'm going to kick it off with a few questions that we have received, and I'll toss it to either Dr. Levitt or our partners in Iowa on their perspective and what they're all seeing. So the first question is for Dr. Levitt. How should we be using the CDC guidance? It seems like the guidance in my state is stricter than what you have in your document. I also saw that CDC has made updates to the guidance. Should we expect more changes? Should I be following the rules in my state, or should I follow what the CDC says?
Okay, well, I'm happy to answer this. CDC develops guidance based on the best scientific data about SARS-CoV-2, the virus that causes COVID-19 illness. 4 months ago, unbelievable as it seems, no one knew this virus existed. The body of evidence about COVID-19 is small but growing, and CDC updates guidance as we learn more about this disease. All of our guidance is considered interim because it will be updated as we learn more. So CDC guidance are science-based recommendations rather than directives. This is to answer the question about who to follow. CDC does not have regulatory authority in this area. State and local authorities have ultimate responsibility to implement and enforce public health measures, and these may include shelter-in-place or stay-at-home orders, limitations on group gatherings, and/or the ability to access goods and services deemed non-essential. In some places, child care is considered essential, or child care specifically for health workers, responders, or other essential workers is considered essential. State and local governments have ultimate authority over what businesses and industries are deemed essential. CDC guidance does not supersede state, local, tribal, or territorial authority.
Great. Thanks, Dr. Levitt. And I'm sorry, were you able to turn to the whether folks should expect more changes?
Yes, I did try to address that we're learning as we go. This is a new virus. We're learning about its transmission. We're learning about what to do to stop it. And that's why if you look at our website, almost everything is called interim guidance. And that's not meant to be wishy-washy. It's meant to be honest, that everything is interim because we have to update as we learn more.
Great, thank you. And for folks who have asked about where this guidance lives, I believe there's a link to it on the CDC's page earlier in the slide deck, and we can share that back out as well. The next question is, yep, of course. Our second question is for our partners in Iowa. So a lot of the child care programs in different states have been running into shortages of supplies. What are you all doing in Iowa to address this particular challenge? And this is, cleaning and sanitation supplies, and then, of course, some of the PPEs that Dr. Levitt talked about.
That's a really good question and a pretty consistent problem. I'm sure it's not only in Iowa, but across the nation. So we've been really recommending to child care providers to kind of think outside of the box and look around at your local community and what can you try to access. So if you cannot get the cleaning supplies and the paper products, maybe approach the local stores in your community, tell them that you are doing child care, that you are taking care of essential employees yet, and that you need to have these supplies. We've had some successes where the stores will take that list, and when supplies actually arrive in, we'll set it off to the side and the child care providers get first access to it. We've had in Iowa, there's 2 regional grocery stores that open up for the first hour for the elderly to get access to supplies first, and they also allow child care providers to get into that groove and to get in there first to get their supplies. We have recommended, and we've heard where parents, as they're out trying to access their own family supplies, have run into some extra supplies. They'll bring them in and donate them. Also reaching out to businesses that are closed. Maybe you have the schools are closed. We've heard from hotels, churches, other organizations like that that are not able to gather, seeing if they have different supplies that you can use. Again, if it's the cleaning product or the disinfectant, make sure it's appropriate for child care. But it's been amazing how many different organizations have stepped up and tried to help the local child care. So while we maybe can't get things on a larger basis, the smaller communities are finding some solutions by reaching out in unique ways. So I think those would be some of the biggest ways that I've been hearing impacted. I know from our Iowa scenario, we were lucky enough, one of our regions, Region 2, could get thermometers. They ordered enough, and we distributed them across the state for the people that really did not have thermometers. So just trying to find your resources and trying to find out what the need is locally has just been kind of challenging, but I think it's one of the great success stories of this is how communities are coming together to find solutions.
Wonderful, thanks. The third question is for Dr. Levitt related to masks. We've gotten a lot of questions about that. What should we be doing for children related to masks? Is it recommended that all children 2 years or older wear cloth masks? I know that is the general recommendation for children in public spaces, but it is unclear if a child care setting would be considered as such.
Okay, well, thank you for this question, which comes up frequently. I'd like to begin by distinguishing between masks, which refers to surgical masks or N95 masks, and cloth face coverings, which are currently recommended, as I think you said in the question. They're recommended by CDC for use in community settings. Surgical masks and N95 respirators are in very short supply and should be reserved for healthcare workers or other medical first responders. Now, the updated CDC guidance for child care programs that was posted last night recommends that when feasible, and I emphasize when feasible, staff members and older children should wear face cloth coverings within the facility. However, cloth face coverings should not be put on babies and children under age 2 because of the danger of suffocation. So again, we do recommend that staff and children wear these face coverings, but we also recognize that that's not always possible. So thanks.
Great, thank you. Dr. Levitt, I have got another question for you, and then I'll turn to a question for our Iowa partners. We have gotten a number of questions about how do we know when it's safe for providers to go back to work after a quarantine or recovering from COVID-19?
Okay, let me make sure I give you the right answer for that. This is about returning to when to know the return to work. I'm not sure that I have the details of that in front of me, but here I can refer you to the right place. Okay. In general, staff members should not return to work until they've met the criteria in the CDC guidance. I'm going to tell you the name of the guidance. I don't have the criteria in front of me, but there's guidance on when to discontinue home isolation. So that's the same, I think, for almost all workers, not only child care workers. And child care program administrators may also refer to CDC's document on interim guidance for businesses and employers. That's sort of what I was saying, that the advice on discontinuing home isolation is pretty much across the board. And it depends on the resolution of symptoms and also the time since symptom onset. And so I recommend that you look at the website on that topic, because I don't want to misstate it. But it's something like you have to wait something like 7 to 10 days after your symptoms have resolved.
Great.
Or actually, sorry, I said that wrong. It's 7 days since the onset, or 3 days after the symptoms have resolved, whichever one is longer. Sorry about that.
Okay, great. Thank you. Just a question for our Iowa partners, and then we'll turn back to Dr. Levitt, to you for some more questions around CDC's guidance. To Melissa and Heidi, can you give folks, knowing that not everyone or most folks on the call are not in Iowa, what is the system of enforcement for the additional health and safety protocols that the emergency child care must follow in your state? How are those protocols enforced?
This is Heidi. I can answer this. So our regulatory enforcement for child care in the state of Iowa is through Department of Human Services. And Department of Human Services and Iowa Department of Public Health have worked together to come up with guidance specifically around COVID-19. And so enforcement and regulation is through the Department of Human Services in our state.
Okay, great. Thank you. Dr. Levitt, one of the other questions that we've gotten quite a bit is around the ideas and recommendations for home daycares. People are saying, listen, a lot of the webinars are more relevant to center settings. With home-based childcare, there's only one person. They can't leave the child unattended. The other children go unattended, go to the curb, take temperatures, bring the child in, all of that. Are there other ways or recommendations that soloists can do this? to keep both the children safe and themselves safe?
Okay, well, that's an important question. We recognize, all of us, that implementation of all the recommendations within the CDC guidance may not be feasible in all situations and may be quite difficult if you're a solo practitioner. So we would advise that you consider which strategies you're fully able to implement. For instance, most of the everyday preventive actions to prevent disease spread are things that a soloist could do. Hand washing, covering coughs and sneezes, cleaning and disinfecting frequently touched surfaces, all of those are very important, and they're the most fundamental things. And also, the updated guidance, as I mentioned a few minutes ago, includes examples of ways that children can be safely screened on arrival without using personal protective equipment, so that they could be done without extra staff or equipment. So I hope that helps.
Great, thank you. Now I'm going to turn to another group of questions that we've gotten around what to do if the child becomes ill while in the care of the child care provider. How do they best care for them while they're waiting for the parents to pick the child up?
Okay, well, I think that one's for me as well, correct?
Yes, please, sorry.
Okay, that's all right. Let me just see. I took notes on that one. Okay. The CDC guidance recommends that child care programs require sick children and staff to stay home. And it's important to establish procedures to ensure the children and staff who come to the child care center sick, or if they become sick while at your facility, are sent home as soon as possible. So our guidance says that if a child becomes sick at your facility, keep sick children and staff separate from well children and staff until they can be sent home. Plan to have an isolation room or area, such as a cot in the corner of the classroom, that can be used to isolate a sick child. Have the child rest in the isolation area until the child can be picked up. If a sick child has been isolated in your facility, clean and disinfect surfaces in your isolation room or area after the sick child has gone home. Now, CDC also has additional information about isolation in related settings that you might be able to apply to child care. There's a website about isolation at home, and there's a website about isolation in healthcare settings. And both of these have helpful information.
Great, thank you. Dr. Levitt, I also wanted to go back to a question that our partners in Iowa spoke to, but wanted to get your thoughts about how child care providers can find adequate supplies to support hand hygiene behaviors and routine cleaning.
Okay, well, I don't know that this really improves on the answer we've already heard, but in our guidance, we recommend that if you need supplies to support hand hygiene behaviors or a disinfection routine cleaning of objects and surfaces, you should contact your local child care resource and referral CCR&R agency to learn more about service organizations in your community who may have additional resources. So basically, I'm just reinforcing what was said, and your local CCR&R agency can be found at the resource pages of Child Care Aware. Isn't that correct?
Yes, thank you. Mm-hmm. Dr. Levitt, more questions coming in for you, so I'm going to turn to another one that we're getting a lot of, which is, how do I practice social distancing with infants and toddlers?
Okay, now that's a really difficult one. We do address that in the guidance. We start with just general social distancing strategies, which I guess I'll repeat, and then a few more that apply more to young children. Okay, so we recommend that you work with your local health officials to determine a set of strategies appropriate for your community situation, and you can consider the following social distancing strategies. If possible, child care classes should include the same group each day, and the same child care provider should remain with the same group each day. If your child care program remains open when there's widespread transmission, consider creating a separate classroom or group for the children of healthcare workers and other first responders. If your program is unable to create a separate classroom, consider serving only the children of healthcare workers and first responders. We also recommend limit the mixing of children to the extent possible, such as by staggering playground times and keeping groups separate for special activities such as art, music, and exercising. If possible, at nap time, ensure that children's nap time mats or cribs are spaced out as much as possible, ideally 6 feet apart. Consider placing children head to toe in order to further reduce the potential for viral spread. Consider staggering arrival and drop-off times and/or have child care providers come outside the facility to pick up the children as they arrive. Your plan for curbside drop-off and pickup should limit direct contact between parents and staff members and adhere to social distancing recommendations. Now, it is important to comfort crying, sad, or anxious infants and toddlers, and they often need to be held. So this does make caring for small children more challenging. To the extent possible, when washing, feeding, or holding very young children, child care providers may protect themselves by wearing an overlarge button-down, long-sleeve shirt and by wearing long hair up off the collar in a ponytail or other updo. Child care providers should wash their hands, neck, and anywhere touched by a child's secretions. Child care providers should change the child's clothes if secretions are on the child's clothes. They should also change their own clothes, the button-down shirt, if there are secretions on it, and wash their hands again. Contaminated clothes should be placed in a plastic bag or washed in a washing machine. Infants, toddlers, and their providers should have multiple changes of clothes. This is a very practical thing. They should have multiple changes of clothes on hand in the child care center or home-based child care. Finally, child care providers should wash their hands before and after handling infant bottles, whether they're prepared at home or prepared in the facility. Bottles, bottle caps, nipples, and other equipment used for bottle feeding should be thoroughly cleaned after each use by washing in a dishwasher or by washing with a bottle brush, soap, and water. So we hope that this guidance is helpful in this very difficult and challenging situation.
Great. Thank you very much to all of our presenters, Dr. Levitt, to Heidi Hotbed, and to Melissa Jewell. I also want to thank those of you in the audience who submitted questions and shared your stories. To ask additional questions, please contact our agency via phone or chat function through our website at childcareaware.org. If we could go now to, there's the number and the information on the slide with the hotline and the chat function. So Child Care Aware of America is committed to continuing this conversation. I know there's a lot more questions that we aren't able to get to in the span of a 1-hour webinar. We have a lot of information up on childcareaware.org for child care providers. So if you go to our website and then you go to the coronavirus hub at the top, the coronavirus link, you will see that there's information specifically for child care providers. And you'll be able to find there, we're updating that constantly. And so there you can find the latest information from CCAOA on dealing with the pandemic. As we receive the latest information and latest tools and resources, we continue to share those out on that website. Next slide, please. And so you'll see here some of the places that you can go. If you would like to go deeper into conversations with your peers and CCAOA's subject matter experts around COVID-19 and how we can together support the infrastructure of childcare across the nation, we encourage you to attend our 2020 virtual symposium on Monday, May 4th. The theme is Breakthrough Barriers and Breakout Solutions. What we are seeing now is that there is a real need for child care providers' voices to be heard by members of Congress so they can fully understand the intense pressures that the sector is under. So you can see more information about this webinar and other policy-related resources on CCAOA's website, which again is childcareaware.org. On behalf of the entire Child Care Aware of America team, we sincerely hope that you and your families are staying safe and healthy during this challenging time. Thank you very much for being here today, and thank you to our presenters.